Okay, so we'll go ahead and get started and let me just welcome everyone officially. Okay, so tonight's event, mental health treatment and legislative advocacy, we are very grateful for you to attend and just want to thank you for being a part of our virtual series. This is part one of our series of the intersection of mental health and legislative advocacy as we head into Mental Health Awareness Month in May. Stay tuned for part two, which we will be highlighting legislative advocacy and youth prevention for suicide, and more details to follow on that. SPAC serves as the advocacy arm of the New Jersey Junior Leagues, giving us a pathway to engage in limited lobbying and broader advocacy within our established focus areas: women's issues, children's welfare and education, and health and environment. We are a nonpartisan group made up of 8 junior leagues across New Jersey. Our mission is to advocate for legislation and initiatives to enhance the lives of women and children. Our other task forces include health equity, food insecurity, and mental health, which we will be focused on this evening. And SPAC has led the charge in the past in the fight against human trafficking, playing a pivotal role in the creation of legislation that prohibits human trafficking in New Jersey. And so tonight, we're happy to feature two amazing women pioneers in the space of mental health and advocacy. Assemblywoman Lisa Swain, New Jersey Legislative District 38, and Tracy Schoenberg, Director of Public Relations and Government Relations Officer for Bergen Newbridge Medical Center. So that's a bit about SPAC and our panelists. I want to now proceed to read the bios. Assemblywoman Swain represents the 38th Legislative District in the New Jersey Assembly. She was sworn in on May 24th, 2018, to succeed Senator Joseph Lagana, and she serves as the chair of the Assembly Appropriations Committee, vice chair of the Assembly State and Local Government Committee, and as a member of the Assembly Education Committee. Prior to joining the state legislature, Assemblywoman Swain gave back to her community by serving on the Fair Lawn Borough Council from 2008 to 2018 and was elected mayor in both 2011 and 2018. Assemblywoman Swain always stays active in her community, working closely with the Fair Lawn Economic Development Corporation, the Green Team, and her constituents to help solve the varied issues. She's an accomplished triathlete and a member of Team USA, the World Championship Triathlon team. She's also the vice president of the North Jersey Masters Track and Field Club. Assemblywoman Swain graduated with a bachelor's from the University of Rochester and has her master's from NYU. She resides in Fair Lawn with her husband, Ron, and has 2 adult kids. Let me read Tracy's bio. Tracy Schoenberg is the Director of Public Relations and Government Relations Officer for Bergen Newbridge Medical Center, the largest hospital in New Jersey. Prior to joining the medical center, she was the Executive Vice President of Communications and Government Affairs for the Commerce and Industry Association of New Jersey. Tracy graduated from Rutgers with a double major in political science and journalism and earned her master's degree in journalism from Columbia University. She was a journalist for many years, working for NBC News and other media outlets, winning an Emmy Award while at News Channel 4 WNBC TV. She was elected 3 times to the Ordells Borough Council in Bergen County, serving as council president for 7 years. Schoenberg is currently on the board of directors of the Girl Scouts of Northern New Jersey and is the chair of their fund development committee. So welcome to Tracy and Assemblywoman Swain. So glad to have you both. And any questions from either of you before we get started?
No, just happy to be here.
Okay.
All right, Tracy, I didn't know about your MA, so congratulations. That's awesome.
Yeah, that's amazing. And so when I said pioneers, then certainly when I read your bio, Assemblywoman, you're a triathlete. So that's just amazing in its own in its own right. So, okay, so we'll go ahead and get started. Okay, so I'll start with the first part of our program, and then I'll turn it over to to Cheryl. Okay, so I'll start with Tracy. So the first part will speak on understanding mental health and treatment and continuum of care. Tracy, can you please just share with us a bit about your work at Bergen Newbridge and help us to understand what continuum of care looks like for someone entering your health system, especially survivors of trauma and domestic violence?
Sure. So we are one of the largest providers of behavioral health care in the state. And for Bergen County, we are the primary destination for those who are experiencing a mental health crisis or situation involving the police, such as a domestic violence incident. Typically, these patients come through our emergency department. We are very well equipped. We have, the dedicated healthcare side, which is pretty typical, your cuts, your bumps, your bruises. But then we also have a dedicated mental health emergency department. And we have staff that is trauma-informed care trained, so that we have social workers and patient navigators who, when someone is coming in, either human trafficking or suspected or domestic violence, that are specially trained in that kind of crisis management that works with our clinical care team to provide the care and support. One of the things that we worked on over the last year is to not only have these folks in the ED, which has been happening for several years, but also to have the ability to, regardless of the hour, make an appointment, a follow-up appointment with our behavioral health professionals or other clinicians before the patient leaves our emergency department, so that we can start that process of having them be well supported and that proper continuum of care, especially if they're not going to come inpatient. Often it's a traumatic incident that's likely happened in the home or the workplace. They may be coming in on their own, or there may be minor children with them. So there may be several different levels that we have to triage. They may not be going inpatient, but need to be admitted to, one of our outpatient programs to provide the care and support that they're going to need as they navigate the waters following whatever incident brought them to our emergency department.
Okay. And then how do you design programs to respond, uh, to these situations, particularly with domestic violence? And, are there any immediate safety concerns that you need to deal with at that time?
Sure. So at Bergen Newbridge, we are very fortunate to have an exceptional relationship with the Bergen County Sheriff's Office. They are our primary law enforcement agency. So not only do they help provide security for the medical center in addition to our in-house staff, but they also are very well versed in liaising when we have someone in crisis, when we have DV come into the ED or through our ambulatory care clinic. They are exceptional at working with our social workers to, you know, determine a care plan moving forward that also includes the safety and security of that patient, whether that's also, at that time engaging with that person, restraining orders or legal options, or perhaps, in addition to the law enforcement side, the resources that they need for temporary housing to remove them from that element where the abuser or the accused is currently residing, and supports for their children, whether it's food, clothes, transportation, etc. And in addition to the law enforcement partnerships, we are very fortunate to have great community relationships with partner organizations, in particular for domestic violence and for human trafficking. We work with the YWCA of Northern New Jersey, and we also work with the Women's Rights Information Center based out of Englewood. Several years ago, Women's Rights was successful in obtaining a grant, and they have a dedicated staff member who is extraordinarily well versed in human trafficking and also, um, trauma informed cases. And so they are an exceptional partner, and they can help us beyond the care that we'll provide, whether it's therapy, whether it's medication, whether it's group. Women's Rights Information Center can come and get that woman, say, who has been out of the workplace, who has been isolated by a partner, get them the clothes they need, the training they need to get back into the workplace. And while we are working together to get them to a healthier space mentally, our community partners come in and provide the support and resources they need to really stand up. Because I mean, I'm sure in this space where you guys have advocated on domestic violence, oftentimes they are financially isolated, and that is what keeps them going back to the abuser, because they do not have money for food, the cars in the abuser's name, etc. And then for some of the other stuff, a lot of domestic violence trauma is a complete break of trust of all people, because you've been violated in such an intimate way. So places like Women's Rights Information Center are doing innovative things like equine therapy that normally, as a safety net hospital, we can't provide that, but through our partners, we can provide that type of therapy, that type of intervention that's going to work best so that we can individualize the care for the people that we're serving. Because it's not, any of you who have ever gone to therapy, it's not a one size fits all. Not every therapist is the right person for you. And so it's by trying to spread our wings and, get with our partners that we found. We have a great partnership right now with the YW for women veterans. Obviously, veteran mental health is a very big issue in the country, but what we don't talk about a lot are the unique issues for women who have served and what they're coming back with and how their PTSD looks different. So that's a new program that we're working with them on. So it literally takes a village to provide the care to elevate somebody out of a situation like that, to take them from that horrific night in the emergency department and bring them to a place where they can have quality of life again.
So it's, to me, what I'm hearing, it sounds like there's effective collaboration between these various agencies and services, and in your area, working very closely with your center. Is there a specific example or that you'd like to share that has worked really well, with this collaboration?
Yeah, I think because resources are so thin at a safety net provider, we are very fortunate that our CEO has the leadership and vision to make sure that we are staffed up when it comes to the social workers and patient navigators, that works at building these relationships and encourages the whole team to make these relationships so that, I'm just thinking of a mother who would come in with a child to the ED, that at whatever time of night it is, that call was placed to somebody who said, I need an emergency housing placement. And then another call was made to how quickly can we get this person into our ESL program? And then our patient relations staff came down and helped this person enroll in Medicaid because the husband was the primary insurer. So if walking meant the insurance went away, how would her kids get their vaccinations? So I think it's our in-house commitment to making sure those physicians are staffed, but it's also those partnerships on the end. Nobody can do it alone. There's no health system, there's no health provider that, even the biggest ones in the state, Hackensack Meridian, Robert Wood Johnson, we're all in the same boat where these community providers are, essential.
Okay, great. And this just kind of, I guess, will lead into some of the work that Assemblywoman Swain has done in the space. And I just, maybe we can move into the legislative part of this. Maybe Assemblywoman, you can share some real world barriers that people face when trying to access consistent mental health support, and sort of how you arrived at crafting the legislation, maybe walking us through a little bit of your bill A2310 and what that is, and share a little bit about that, and certainly bring in some of the comments shared by Tracy.
Thank you. Yes, I'd be happy to. Yeah, Tracy works at a great place, and I've been over there a number of times. They're always innovating new programs, and especially I've noticed over the last several months that I've been there, a lot of programs for women and marginalized communities. So really, everybody should feel included in the programs that are available to them. Specifically, what I have worked on having to do with domestic violence. First of all, I'd say the biggest barrier, which has already been mentioned, is cost. Um, if, as Tracy mentioned, in those kinds of examples where someone has to leave a situation and they don't have their own insurance, right away, the cost factor is evident. Insurance coverage, again, that may not be available or it may be inconsistent. Um, and then, another barrier that I think we all can relate to is the stigma of what people are going through when it comes to domestic violence. And what we noticed is that, there is a gap, this gap of coverage. It relates to cost and it also relates to the stigma of mental health. And that is that insurance companies will cover physical ailments. If you break your leg, if you have diabetes, there's a diagnosis code and you'll get covered. But for domestic violence, people of survivors, what they need is therapy. And we felt that that was really important, that they get therapy and that it be covered by the insurance companies, because right now it's not. So, somebody can go to Newbridge Medical and, they can get taken care of if they have their bruises. And they can also, fortunately, have access to therapy, but who's going to pay for that? And that's where, as a legislator, I came in to try to create access for people to, bring in that equality that really matters. I mean, obviously, we know that, most of the survivors, although there are men, but most are women, and we really wanted to address that issue. So basically, the legislation ensures that mental health care for survivors is recognized as medically necessary, guaranteeing full benefit coverage across all types of plans, individual, group, and public employee plans.
Okay, that's great. And then were there any survivor stories that helped to craft the language within your bill, or anything that occurred, or what voices might have helped to push this forward, to help to give some shape and input to the language of the bill?
There were two instances that made me relate to this. One is that one of the councilmen in my district in New Milford, Matt Seymour, has been putting on a symposium for a number of years about domestic violence. He brings together attorneys, judges, um, resource people, brings them all together and talks about the issues so that, people have a way to discover what is available in Bergen County and beyond. And it's really a great symposium, and every year it grows, which is unfortunate, but at least a lot of people are getting access to this information. The other thing that really made me interested in this issue is the human trafficking. And several years ago, there was a bill about preventing human trafficking, and we had what's called a red sand project, where we took red sand outside of the State House and poured it in the cracks in the cement. And it was very symbolic because it represented all the people who fall through the system. And there was a woman who had been trafficked all around the world. Her story was so compelling. And I just felt I had to be able to do something. So, I realize that's domestic violence is not exactly human trafficking, but it's still a way of addressing what goes on with, people who are in this terrible situation where they need to survive a very bad home situation.
And it actually is relevant because of and certainly that's why we do the work that we do, and we find that all of our different areas of focus really are intertwined. And certainly mental health encompasses, really just sort of runs a thread through everything that we do. So it's very, very much relevant. And Tracy had mentioned, some of the work that she's done and it pertained to human trafficking. And then, as you know, we're going to be, we're the junior leagues are working very closely with the New Jersey Coalition Against Human Trafficking in preparation for the World Cup. And so we will have some other programs that are coming up down the road, and we'll certainly keep you in the loop. I've already shared a bit with Tracy on that, but we will be, certainly working together with her and others on some programs related to that. So yes, it's all relevant and important. We do have our leaders, our task force leaders on the call tonight about human trafficking. So again, it's all related. So thank you for sharing that. I guess a final question just for this block. Any challenges, any roadblocks that, I know funding is always a challenge, political will, anything that you would consider a challenge or a roadblock when, putting forth legislation uh, such as this bill.
Um, I would say that, addressing these issues with insurance companies is a huge roadblock. Um, I'm doing it a lot with a lot of different bills. For instance, one of the bills that I had been pushing for, and it just got voted on in the Assembly a couple of weeks ago, was step therapy. And so, for those of you who don't know what step therapy is, it's basically, for people who are really in need of some serious medications, the doctor prescribes, let's say, X medication. But then the insurance company says, no, we're not going to start with that. We're going to start with a less expensive medication, see how you do. And then after you fail on that medication, then maybe we'll move you up to another medication and then another. And then finally, you'll get to go on the one that the doctor originally prescribed. In the meantime, patients get very sick and can be and almost die. And I've spoken to patients who have suffered through this. Um, I have a number of bills addressing, I have another one on mammograms. Like, when you get your mammogram, the insurance will pay for that initial mammogram. But sometimes, like me, I have dense breasts. I very often had to get an additional sonogram to make sure there was nothing there. Well, the insurance companies don't want to pay for that additional sonogram. So, my bill would make sure that insurance companies pay for the full process so you get a full diagnosis. So anyway, that is a major roadblock. The insurance companies probably hate me,
Well,
but
and that's what's so interesting about your legislation. Just domestic violence, victims, survivors being treated, from a mental health perspective, and that it being counted and relevant to insurance companies, that seeing it as an opportunity, or that they may not see it as an opportunity to be treated, for health insurance companies to pay for it, to pay for the treatment. And I think this is really an awareness that all of us really should have. And maybe we may not necessarily think it's relevant to us, but in my mind, what is relevant to one woman is certainly relevant to me. And so I'm grateful to even have this awareness, and that this legislation that you have authored. And do we know where we are with this legislation? Can you give sort of some feedback on that?
Well, the step therapy one is moving along. So that's great. The mammogram I just introduced, so it has a little ways to go. It takes time in Trenton to get
Sure.
things moving along. Bills have to be heard before committees. They have to be identical in the Assembly and the Senate, voted on by both houses, and then signed by the governor. So.
Okay, okay. And that's a nice education for all of us to be reminded, how a bill becomes a law, right? And for those of us who remember Schoolhouse Rock, that's still one of my favorites. Um, I won't sing, I'll spare everyone. Uh, so I'd like to just, before we turn it over to Cheryl, Tracy, I'd like to just ask you, certainly what the Assemblywoman has shared, how do legislative changes or bills such as A2310 translate to practical impact for you on the ground?
Yeah, I mean, I think we're incredibly fortunate to be in LD 38, and Lisa is extraordinarily involved with the medical center. Anytime we have an event or a new service line, she and her team are there. They're asking the questions. And I think that's one of the most important things that can happen when legislators, it's one thing to discuss an issue, but when you are on the ground and you're seeing it live and you're hearing the clinicians speak about it, or you're hearing patient testimonials, I think it informs and it makes for better legislation. And I think, a lot of the bills that Lisa has talked about that she has put forward as a sponsor are responses to what she has seen and what she hears from her constituents. And for us, that's the most helpful, because something can seem like, well, it's just common sense to make sure that domestic violence survivors get the help and therapy that they need. But if it's not codified, if it's not a regulation, if it's not an official policy, insurance companies are very reluctant to pay for it. And so sometimes you have to compel the insurers to do the right thing. And so that's the cases where legislation is necessary. So for the work we do serving the most vulnerable people in the state of New Jersey, it's legislators like Lisa or Assemblywoman Carol Murphy, the new chair of Assembly Health, who sat down a couple weeks ago at the Hospital Association headquarters and just had a frank conversation about what her committee was going to put, on agendas upcoming, and asking our honest opinion and getting our feedback. And I think that's where Trenton and serving the people they represent works best, is when the legislators are actively involved in asking the questions that shapes the legislation, that changes lives, that saves lives on the ground. Because again, something that may seem common sense to you and I, well, why aren't we doing that? Well, it turns out there's a loophole, Lisa. There's always some out, or there's always something that doesn't compel, whether it's a provider, whether it's an agency or whatever. And it's fixing those loopholes so that that red sand doesn't fall into the cracks, so that we don't lose the most vulnerable people who could have their lives changed for the better if only they had had that therapy. Anyone who knows someone who's a victim of domestic violence, it can be 10, 15, 20 years later, and sometimes there will be triggers. And if there isn't a foundation where at that moment of crisis and in the months intervening after they didn't get the proper support, you now have someone in crisis who's repressed it or has PTSD. So, I think it's absolutely critical work that Lisa and her colleagues are doing, especially in terms of behavioral health and women's health over the last 18 months or so in particular, has been extraordinarily helpful.
Thank you. Thank you.
And could I just add a little something? Tracy just touched on so many important points. And my philosophy on life is to be proactive. And if you are proactive and you do the right thing at the right time, then you will actually save money in the long run. Because if these women, these survivors, get the therapy they need when they need it, there's a chance they're going to get themselves out of that relationship and onto a better life, and they're not going to need the medical community quite as much to take care of them. And it's the same thing, like I talked about with step therapy. If you take care of a person when they're sick and you get them the right medication and they heal, then you got a good story. But if you force them into these other non-effective medications, and then they become sicker, they need so much more help that costs so much more money. And I think a lot of people do not think about the long-term effects of all the things we're discussing.
Thank you for that. Absolutely. Okay, we're gonna go ahead and move to the next part of our program, Bridging the Gap, Integrating Mental Health Support and Policy. So I'll turn it over to Cheryl to continue with our panel questions. Cheryl?
For both of you. So Tracy, I know we talked a little bit too about this the other day. So where do you see the greatest disconnect between mental health needs and available resources or insurance company, especially given the current landscape?
I think one of the issues with insurers in particular is for most of us, if you've had to avail yourselves of behavioral health care, oftentimes it's a subsidiary or a separate part of your insurer. So it is not the same as going through your medical insurance like you would if you go to see a doctor, you show your card that you have to apply or you have to get pre-certified. There's a whole different list of rules. There's also a whole different list of rules for providers. So for our psychiatrists who are practicing MDs, they may be on United Healthcare, just for a random example, for their healthcare side, but then they have to get credentialed on the behavioral health side. So then there's a lag in time under which the providers are not able to provide care for those who have insurance companies X, Y, and Z until they are credentialed. So I think that's one of the bigger problems in terms of the mechanics, the administration of behavioral health. And I think one of the biggest challenges we have is long before the pandemic, our teens and youth were in a mental health crisis. We had extraordinary numbers of young people with suicidal ideation, attempts, major depressive disorder. COVID came and made that infinitely more bad for those kids. And we have limited resources for them. So I think one of the things that we struggle with is making that connection. Like there are only 11 children's crisis inpatient locations in the state of New Jersey, and we're one of them. So if you have a 5-year-old that's having a very severe psychiatric mental health crisis, there's only one of 11 places in the state to go to where your child can be inpatient, have school done with a certified teacher during the day, and get the care and support that's needed. We just recently opened an acute partial hospitalization program for at-risk teens, ages 13 to 17, because there aren't enough programs for those teens who have not only a mental health diagnosis, but also have a substance use disorder, oftentimes medicating for that underlying disorder. We had such a need for it that we petitioned the state to get a license. So I think we need to do a better job of making it accessible because parents don't know where to go when you are in crisis and it is late at night and you have a child that's having suicidal ideation. There's also a lot of runway left to help parents navigate far better. The thing we hear the most is, I just wish I knew that I could have come here to the ED, or I just wish I knew there was a helpline. So I think that's an area where we have a lot of work and advocacy to do. And I think also connecting providers like us with school districts more firmly, because I know school districts have struggled. I had a friend who child was in absolute crisis, went into the guidance counselor that Monday morning. It was a very bad Sunday night in their house. And even though the son was absolutely in a mental health crisis, it was 3 weeks before the school psychologist was going to be able to meet because the appointments were so overloaded. So I think we have an access issue for sure. And that's something that needs to be addressed. It's acute for children and teens. I mean, it's for everybody. We just don't have enough providers, but I would say that those are the sort of the biggest issues.
Thank you. And Assemblywoman Swain, do you have any comments on this?
Well, I mean, Tracy hit the nail on the head, and she's on the front lines every single day. I think that if we look for the silver lining in the pandemic, it was the realization. I mean, as Tracy said, I think that the crisis was brewing before the pandemic, but then during the pandemic, it became so apparent that our kids really needed help. And we were still, though, dealing with the stigma. I still think it's hard for families who recognize that their kids may need care or they need care to get outside of that image that, oh my God, if I go see a therapist, I'm bad, or, there's something wrong with me. It's the education of realizing that whether you have diabetes or you have a personality disorder, it's still a body function and it should be addressed, and they should be addressed equally. We should not look down upon people who have behavioral health issues. There's absolutely nothing wrong, but it's been hard. But I think the fact that so many more people are now open to therapy has been a good thing.
So that leads into my next question, which is how can advocates like many of us on this call help bridge that gap, whether it's through storytelling, research, or how can we partner with you to help you? So.
Well, first of all, there is a funding issue. I mean, I'm not asking you to pay for it, but the example that Tracy gave about a student waiting to see a psychologist, that is so true. There just aren't enough people, enough therapists, school psychologists. Some of them go from school to school. And so I think that educating everyone to recognize that there is an issue, that we need to support our education system, that we have to vote for the school budgets, because without our educators, we've got nothing. So that's something. And then I think we all really have to take care of each other. I think that there's a lot of animosity out there. In my education committee, we recently passed a bill to ban cell phones in schools. Hopefully it will go through. It's not a total ban. It will leave some discretion up to the school, but I think that we can all agree that, cell phones have contributed to this mental health crisis. And by supporting the schools and the programs that they want to put in place, like removing cell phones, I think if we can get behind that to support our students, I think that we can see success then. So, I look at it as it's like a whole village approach. There's, so many things that we can do, but the bottom line is we have to support each other.
And I would say, in terms of, how can your organization, how can your advocacy help? 2/3 of our payer source at Bergen Newbridge is charity care and Medicaid. With the proposed cuts to Medicaid, it will be devastating for providers like myself, like St. Joe's in Patterson, like Cooper down in Camden, because we are, for many people, the only option for care, because the Medicaid reimbursement rate is so much lower. You can have the same procedure, the same physician visit, but what a commercial payer pays versus what a Medicaid reimbursement is wildly different. For example, we created the Center for Eating Disorders and Body Positivity because there was no close enough place for teens and adults to get eating disorder treatment that accepted Medicaid. So there are gaps in care, there are gaps in support, there are gaps in treatment, because it's not financially sensible for a standalone practice to take folks with Medicaid. We do a lot of bariatric surgery that's medically required for diabetics, for those who have cardiac disease. Standalone ambulatory surgery centers, by and large, don't take Medicaid because they wouldn't be able to keep the lights on and they wouldn't be able to keep the doors open. So I would say that advocacy for keeping Medicaid funding is extraordinarily important. And we are at a very critical time where they will be making some very serious decisions over the next few weeks in Washington, D.C. There is also the behind the scenes thing that is happening, that unless you are sort of, reading through the million political newsletters like I do every morning for my job, there have already been significant cuts in funding that are insidious and have immediately impacted programs for vulnerable populations. You may have read that HHS said, hey, that COVID fund that Biden said you could use for other health things that you discovered during COVID, like in Alaska, they were still using handwritten records in some areas. So here you can make your records electronic. In New Jersey, the Murphy administration and the legislature said, hey, you guys, we're going to create these grant programs. And one of them was TRIPS. And that helped pay for transportation for those who didn't have it. In our case, to get to your substance use disorder and your behavioral health appointments, 1/3 of our monthly funding is gone. An executive order was signed on March 28th. The Human Services and Department of Health had a weekend. I'm sure it must have been hellish, where they had to come up with $350 million total to give back to the federal government that Monday. So we now have to figure out how 33% of our transportation budget to get our people back. To Lisa's point, even if you were being mercenary and you didn't care about people financially, it's just going to cost you longer in the end if people aren't coming for their follow-ups. And then the other was the Special Populations Grant, which was enabling our LGBTQ plus patients with substance use disorder come to a program and get substance use disorder treatment that was culturally competent and was bringing them in because there's a different culture of use in that community. And that funding went away overnight. So that is the place for advocacy, where when you hear these DOGE cuts and whatever, they're already slicing very deep into the apple, and a lot of us are already significantly impacted. So if you compound the potential Medicaid cuts on top of that, we are going to have to make some very, very difficult choices on what doors remain open for care.
And wait, another question, kind of leading onto that. So what's one more thing that you wish people understood about the complexity of healing after domestic violence? And also, please, feel free to keep the current landscape in mind of that. So,
Is that for me or Tracy?
Whichever one of you would like to take it first.
I'll start so Tracy can rest. I think what's really important is that people know that there are resources and there are programs out there. Newbridge has, you just heard from Tracy, all these fantastic programs. There are other organizations, the Women's Rights, which, by the way, they also have attorneys on staff who will help in those legal situations that survivors of domestic violence face. Hackensack Hospital has a center also for the kids who are dealing with the after effects of domestic violence. I think what people need to know, like, people forget that there are legislators, like people like me, like our offices know about a lot of these programs, but people don't think to call us. And if they just pick up the phone, and we can help them get in touch with whatever is the right program. So that's something that maybe you can share on a bigger scale, because there are programs out there. I mean, it's hard. I'm not going to say it's an easy process, but there are resources available.
And I'll say especially in this space, when you're dealing with vulnerable populations or people who have been through this very specific type of trauma, we're not competing with each other for patients. We're not, it's a very, very collaborative process. So if we can't help you, we will find the people who can help you. And, Lisa's office, I engage with her staff probably at least once a week, whether it's an issue from their constituent side, whether it's something that we have a question about program wise, or legislation that we feel would help, would sort of cover a gap that we're realizing in real time. So I think, I echo Lisa's point. It's about picking up the phone and not being afraid to. And I think that's another space for advocacy, is, to not be afraid to, your elected officials are there for a reason, and they have exceptional constituent relations. and they are very engaged with all of us. This is why Lisa's talking about the lawyers at Women's Rights, and because they spend their days, and the congressional delegations office is the same thing. We always get calls from them. So I think informing people and then reinforcing for those who may be aware of it but not thinking in that moment of crisis that there are lifelines, there are access to help, and to not hesitate to reach out to your elected officials' offices, because all of us partner organizations stand behind them and are, willing to engage with whatever their constituent issue is.
Thank you. So we'd like to open it up. Does anybody have a question that they would like to answer? This is the Q&A portion. Leslie.
Thank you very much for this conversation and learning about all the aspects of knowing mental illness, and that it's a crisis that really crosses over to human trafficking, which really is what we're dealing with, every day. If we knew, requiring that there's more call to action, even in Bergen County, where I am, can you just know what the immediate need would be so that we can actually address this ourselves within our advocacy group in Bergen County that you can see right now?
Well, I think it was Victoria. I think you mentioned at the outset about the Meadowlands, this, the soccer tournament, the World Cup that we're going to have. And, Bergen County has been preparing, the state has been preparing. I think that a lot of people are worried about the human trafficking that most likely will occur. But if there are things that we can do to mitigate it, and I think maybe that's where organizations like yours can help us by spreading the message. I could certainly find out if there are any committees, or, if there is a way for you guys to implement that call to action to your members.
Yeah, and I would say in Bergen County, I think it's very much worth a meeting with Eleanor Cantu, the CEO of YWCA of Northern New Jersey, and with Lil Corcoran at Women's Rights Information Center. They are in the trenches. They are very active members of the New Jersey Coalition Against Human Trafficking. That's the reason, well, amongst many others, that we partner with them, but particularly in this area, especially, people go, oh, Bergen County, it's not human trafficking here. Well, sad to say, it's everywhere, including Bergen County. Just like people are like, there's a safety net hospital in Bergen County. Particularly in the case of, and I know Lisa's experienced this, the two Bergen counties, Southern Bergen County and Northern Bergen County are two very wildly different places. And what happens to some of our immigrant communities and our undocumented residents who are the most likely to be victims of human trafficking, of domestic violence, and not report it for fear, especially now being turned into ICE. The YWCA and the Women's Rights Information Center have the trust of the communities, and they would be able to share how best to engage with their efforts. I know that both organizations are always looking for mentors or supporters for their outreach, whether it's getting a grant to sustain their human trafficking expert like Women's Rights, et cetera. So, I mean, those two organizations, they've done extraordinary work in this area. And I think a partnership and an informational meeting to start with would be a great start to your work. And, we have a meeting on Friday with one of the representatives from the FIFA committee to talk about, what role we might be able to have as a medical center, but also, we have social workers trained specific to human trafficking and at-risk, vulnerable, particularly, as Lisa said, women, for domestic violence related issues that might come out of the World Cup. I mean, we know this because World Cups around the world have unfortunately had this history of being an epicenter for human trafficking based on the volume of people coming in. So that would be my suggestion in Bergen County.
Thank you very much.
And certainly, yes, we are as the league, we are definitely shining a light on this issue. and on this topic, and we're working together. We're formulating, getting our ducks in a row and preparing. And we are, we'll be working with the New Jersey Coalition Against Human Trafficking in this effort. We've already put together a game plan in terms of having a seminar, webinar that we'll be collaborating and working together to put together and plan in January as a kickoff. And we'll be engaging all of our 8 leagues in some work in terms of assembling and packaging materials to then take those materials out, again, working under the leadership and guidance of the coalition to go out to hotels and other venues to distribute those assembled packages that we will be putting together. So we have put together a game plan where the Junior League will definitely be there, working with our partners, working certainly with the coalition leading the way, and certainly building these relationships. Certainly, glad to have met Tracy and Walk to Washington, and sort of again casting our wide net and working with powerful voices in the community, again to shine a light on this topic. So definitely, again, all relevant. I know we were saying, domestic violence and human trafficking, again, mental health, it's all intertwined. And the Junior League is definitely working to maintain our leadership in supporting women and children and families. Just want to, Denise, one of our other delegates from Montclair Newark, I believe she had a question. Did you want us to read that for you, Denise, or did you want to share that? Or Simone, I know you were monitoring the.
I can ask it.
Okay.
I just wanted to know, I had a question, that was pretty much stated about the funding cuts that are happening. But there was a recent article that the president of the administration is contemplating defunding the LGBTQ portion of the 988 lifeline. And my other question is, do you get patients as a result of them using the 988 lifeline?
Yes, we definitely get patients through 988. I will say, historically, before the Trump administration came into office for a second time, our answer rate for 988 in New Jersey was only at about 75%. So we definitely have, a lot that we're going to need to look at in terms of, that number being as effective as it could possibly be. We also have 262 HELP in Bergen County, which is a long existing help and assistance line that functions very much like 988. So we get referrals of patients through both of those. But I know, and Lisa could probably talk to this better, states were asked originally to come up with some sort of funding mechanism for their part of 988 to take it over foundationally, financially, and then also expand it potentially, which could maybe address the quarter of calls that are not responded to in real time. And I know Governor Murphy in the latest budget had put in a potential tax on phone lines that which is the mechanism a lot of states use to keep 988 standing up.
Great, thank you. I think we'll start to move to our to closing the program, and just want to again thank you both for your time. I guess the final question that that I have for you, and as I was alluding to earlier in terms of our approach that we're working together with the coalition. And then, of course, bringing in the SOAP project is what I was referring to. Teresa Flores is the founder and executive director of the SOAP project, and then we will be partnering along with her, through the coalition to utilize the supplies that she has made available, where we can then order those supplies, soap or toiletries, and then put labels on those toiletries and soap, and then that be a part of the packet of personal items that we would take out in teams to deliver to hotels and other places where potentially there are victims of human trafficking. So again, an approach that we're collaborating together. I would ask both of you, given the challenges of this topic, human trafficking, domestic violence, as tragic as it is there anything that gives you hope as we, speak, on this traumatic issue?
I think that what gives me hope is I look to each election, and we have an election this year for a new governor, also the state assembly, we're all up. But, tonight we have talked about the issues that are really important to us and the funding that goes along with all the different programs. If Medicaid is cut, Tracy won't have a job. There will be no hospital. All the people who need those services will not be served. And it goes obviously throughout the state and beyond that. So, really the biggest call to action is to make sure that you vote, and you vote for the people who support your priorities, the people who are going to keep funding these kinds of programs. And, that to me, that is the most important thing that we can all do. And that's what gives me hope when there's another election, and then there'll be another election in 26 for the Congress.
Great. Tracy?
Yeah, I think the thing that gives me hope and that, keeps all of us going in these relatively dark times in healthcare, especially those of us in the safety net area, are our success stories, where patients who came into our emergency department on probably the darkest night of their life, write how they are finally out of that hole. Their kids are in a safe environment, that our clinicians, our social workers, they never thought they could change their life. And that's one of the best parts of my job, is the patient reviews and the patient experience notes. Some of them will come back and they will speak in group to encourage those who are currently going through therapy, whether because of domestic violence, someone turned to substance use, whatever. Some of them will go and get certified to be peer recovery specialists or peer experts, to give back so they can share their experience, and show people that there's a light at the end of the tunnel. And, that for me is the most gratifying, because although it may be very difficult to do my job and for our clinicians to do their job with this cloud hanging over us, it's those people that walk out of our doors successfully and have a better health and wellness outcome and have a better quality of life, and that those around them are improved by it. That's what makes it all worthwhile. And I think, you should all feel the same way when you deliver those toiletry kits and that woman finally sees that number on that bar of soap and calls and gets the help to get them out of that human trafficking. It's, working with vulnerable populations. It's one day at a time, one patient at a time. And that's sometimes how we make the difference. And that one person that you affect, that you get out of that situation, could turn around and reach a hand back and bring 20 more people with them, over the next decade. So that I will leave with the positive. There's a lot of light for those who have made it to the end of the tunnel, and it's extraordinary to be a part of that process.
Well, thank you both so very much. I mean, our goal tonight was to understand how healthcare systems and policy work together, and the intersection of mental health and legislative advocacy work together to support survivors. And certainly you've highlighted how we can all play a role in that. And certainly the Junior League, we will definitely play our role as women, as leaders, pioneers like yourselves, Assemblywoman, and your triathlon. I'm so impressed with that. And certainly in Tracy, your Emmy. I did not realize that. So I mean, I feel really blessed to be able to again really say highlighting women pioneers. And I think we all are pioneers in our own right. And you certainly, the two of you, have given us hope just in the work that you do. So very appreciative and grateful for your time. And we will absolutely still, stay connected and stay in touch and let you know what we're doing on our side. And then we'll certainly be watching those bills. You can count on that, Assemblywoman. We'll be watching those bills and seeing what we can do to support.
And
So
thank you all for what you're doing.
you're welcome.
Yes, thank you. And if anyone, wants to reach out, Victoria and Cheryl both have my contact information. We're happy to have you as a visitor at Bergen Newbridge, and I'm happy to talk offline about any initiatives you have. But as Lisa said, thank you. The more voices, the better for all that we're trying to do to improve lives in New Jersey and around the world, basically.
Fabulous. Well, thank you. Thank you very much. And we will definitely be in touch. Thank you. Thank you all. Good night.
Good night.